Ladies and gentlemen, this is a story that came out in the Washington Post May 12th, 2020, and the last update was at 4:39 p.m. As you can see on the screen, 81,506 people have died from coronavirus in the US, and at least 1,360,000 cases have been reported. Wow. The disease caused by the novel coronavirus has killed at least 81,000 people in the US. The country's earliest COVID 19 fatality was thought to be a 58-year-old man near Seattle, whose death was announced on February 29th. But on April 22nd, officials in California announced that tissue from two people who had died in early mid February in Santa Clara County had tested positive, signaling the virus may have spread in the country weeks earlier than previously thought, which I would not be surprised at all. I think it's been here a lot longer than what they're saying. As the death toll rose through March and April, and US testing lagged, criteria for testing death changed in some states and cities. Even now, jurisdictions continue to fine tune their counting and reporting procedures. So, numbers in this piece may fluctuate as local authorities classify and reclassify cases. New York City, for instance, in mid April, added to its total more than 3,700 deaths of people who presumed to have COVID 19 but were never tested. By April 13th, the virus had killed in every state. Let's see what the. Oh, okay. Because testing was slow to begin in the United States, health officials agree that the number of reported cases is much lower than the actual number of people who have the disease, and that even the count of deaths is probably low because of differences in reporting by overwhelmed local jurisdictions. Hotspots have erupted in a few places with the largest outbreak, none more dire than in New York, where at least 338,000 cases have been reported and at least 26,000 have died since March 14th, when Governor Andrew M. Cuomo announced the death of an 82-year-old woman. Although it is a populous state, New York also leads the country in deaths per 100,000 residents. Neighboring states are not far behind. Yeah, because I know New Jersey is right on their heel. Hard-hit Louisiana suffered an early outbreak in New Orleans, which may have been fueled by the month-long carnival celebration that drew more than 1 million people to the city in February and accumulated. Okay, so that was during Mardi Gras. I'm just looking at the numbers as I'm talking to you. Okay, wow. But those are far from the only areas struggling to contain the disease and treat its victims. Washington, where the US outbreak was first announced in early February, has had a high number of deaths among older people, particularly in the Seattle area. The disease took root early in several King County nursing homes and facilities that care for older, sicker people. More deaths worldwide have occurred among people older than 50 and those with underlying health problems, as they are often most vulnerable to respiratory disease. Wayne County, Michigan, which includes Detroit, has a high rate of infection per capita, thanks in part, health officials told Detroit Free Press, to economic disparities. People in areas concentrated poverty tend to have the higher rates of diabetes, heart disease, and obesity. The virus is not just an urban issue. Sparsely populated rural areas don't have the huge raw number of cases or deaths that cities are reporting, but some rank highly in deaths and cases per capita. People in very rural areas are more likely to die of flu than urbanites, and many more vulnerable to COVID 19 as well, according to a post analysis of CDC data. A handful of counties in southwest Georgia have some of the highest rates of infection and deaths in the country. The governor sent Georgia National Guard troops to help with medical care in Dougherty County, which has fewer than 100,000 people, but more than 1,000 cases and dozens of deaths. However, not all numbers are terrible. California Governor Gavin Newsom was the first to issue a statewide stay-at-home order on March 19th in an attempt to contain the spread of the disease that had already infiltrated the San Francisco Bay Area and greater Los Angeles. Most governors eventually issued similar orders, and preliminary data shows that early social distancing orders are working. They're not going to work now because people are going back out there. So all of this social distancing is all in vain if you're going to reopen the country and everybody gets reinfected or get new infections all over again. On April 16th, the virus appeared to be waning in some places and just arriving in others. The Trump administration released a framework for reopening the country, which is way too premature. If you're up to 81,000 deaths, it's way too, look, this number is about how many opioid addicts die in a 1-year period, which we know they're lowballing the numbers, but these are the type of numbers they put out for that. This occurred over an 8-week period, 81,506 people, y'all. And we got a president sitting around talking about reopening the country as his own people in the coronavirus task force have to self-quarantine. I mean, the whole thing makes no sense, but it hasn't made sense for centuries. It's not going to make sense now. So please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.